Welcome everybody to the Canadian Diabetes Association's 2016 webinar series. My name is Farah Ismail and I will be your host for today. We're delighted that you're able to join us today for a webinar to learn about lows and highs blood glucose control. Now to start off, I'd like to draw your attention to the survey. It's located at the top right-hand section of your screen. In order to better serve your needs, we kindly ask that you provide your input by completing the short survey towards the end of the presentation, and we thank you in advance for your input. Throughout the presentation, you will have the opportunity to type in the question and answer box, and that's located at the bottom right-hand section of your screen. And we ask that you use this for any questions that you have along the way, and our speaker will be happy to answer them at the end of the presentation. As well, today we will be displaying a few polling questions throughout the presentation and would love for your participation. Please note that your answers are completely anonymous. Also note that you're able to customize your screens. You can expand and collapse them as you see fit, and that's simply done by dragging down the bottom right-hand corner of each of the webinar pods. Our presentation today will last about 40 minutes in length, and we'll have about 15 minutes at the end for questions. And it is important to note that our presentation is recorded and will be made available on our diabetes website. Before I introduce our speaker today, I'd like to thank our supporters of this webinar, Canola Eat Well and LifeScan One Touch, for being a part of our webinar program. And now I'd like to welcome our speaker, Celia Fredericks, and thank her for joining us today. But before turning it over to Celia, I'd like to give you a brief introduction. Celia is a clinical nurse specialist, certified diabetes educator, and certified pump trainer at the Leadership Sinai Center for Diabetes at Mount Sinai Hospital. As a member of the interdisciplinary team for 19 years, she provides both inpatient and outpatient diabetes consultation to people with both type 1 and type 2 diabetes. She is active in the gestational diabetes program. Celia is a contributing author to 2 diabetes self-learning manuals for the Canadian Diabetes Association. For more information on Celia, please read the speaker bio section, which is located at the left of your screen. So without further ado, I present to you Celia Fredericks.
Thank you, Sarah, for that introduction. So before we get started, we'd like to do some polling. So the first question is, how are you affected by diabetes? So if you could just choose one of these, and then we will review the poll results. That's wonderful. I can see a lot of people have type 1 diabetes, so I'm looking forward to lots of questions. The next question is, how are you participating today? So if you could complete this for us, that would be wonderful. Thank you. So mostly people are doing it on an individual basis. Great. So let's get started with our objectives. So first of all, thank you very much. It's a pleasure for me to be speaking with you this evening. So let's review what I'm going to be speaking about. I'm going to talk about causes of low blood glucose, to identify the signs and symptoms of and concerns about low blood glucose, to identify the causes of high blood sugar levels, and to understand the guidelines for driving with diabetes. We have another polling question. Hypoglycemia is 1, A or B? So let's see what people think it is. Oh, 75% of you got that right, when there's more insulin in the blood than glucose. So let's find out why that happens. So what causes lows and highs in diabetes? Well, there's a very fine balance between glucose and insulin levels in the body. So, as 75 of you knew, when there is more insulin in the blood than glucose, you have hypoglycemia or lows. When there's more glucose in the blood than insulin, you have hyperglycemia. So what is hypoglycemia and what happens? It usually occurs when blood glucose levels is less than 4 millimoles. You may feel headachy, sweaty and shaky. Sweaty and shaky are usually the first symptoms that people feel. They also feel very hungry. You may feel dizzy. And if left untreated, you'll get a little confused. I also want to point out that if your blood glucose levels were high, and I'm talking, let's say, more than 12, 11, 12, and you start diabetes medications and your blood glucose come down towards your target, you may feel that you feel sweaty and shaky when it gets to 6 or 7. And the reason is your blood sugars have been high, and now as they are slowly coming down, the body is telling you that something is wrong because your blood sugars have been high for so long. What is important to note is that, you can treat it with just taking one glucose tab or just drink a little juice, and after 1 or 2 days, that will change as your blood glucose goes towards normal. So who can have a low? Well, when you're taking insulin for diabetes, when you take insulin with other diabetes medication, and when you take any diabetes medication that increases the body's insulin secretion. When can lows happen? Well, it can happen at any time. When you take too much insulin, you take the insulin at the wrong time or the wrong type. For example, if you're taking meal insulin during the day and long-acting insulin at bedtime, if you make a mistake and take the meal insulin or the rapid-acting insulin at bedtime, what will happen is it's the wrong insulin at the wrong time, wrong type at the wrong time. Your blood sugars can go low. If this should happen to you, it's important that you stay up for about 2 hours at least, eat a large snack, and test your blood sugar 1 and then again 2 hours after you've made the mistake, after the time you took the insulin. You can also have a low when insulin is working hard or peaking. When it's after about 90 minutes, when you take rapid-acting insulin, this can happen. You can take too much diabetes medication. For example, you could take your medication in the morning and forgot that you took your medication and take it again. If you have too little food or delayed meal or snack. This can sometimes happen when people take mixed insulin. At lunchtime, if they don't have a meal or snack, their blood sugars may drop and they may have a low. Too much activity or unplanned or unexpected physical activity. Drinking alcohol. So drinking alcohol in excess or more than normal can also interfere with the blood glucose. And the reason is that when you're drinking alcohol, your liver is busy processing the alcohol and is not able to release glucose to bring your blood glucose back up should you have a low. Chronic kidney disease. Insulin is cleared from the body more slowly when you have chronic kidney disease. So again, this can lead to lows. It is so important to treat a low immediately because it can progress very quickly from a mild low where you can treat it yourself to a moderate low where you may need some help. So the person can still speak to you, but they feel they're a little dizzy and they feel unsteady on their feet and they're not very comfortable going to get some juice or glucose tablets. And of course, if it's not treated immediately, you can also progress to a severe low where you cannot help yourself and someone needs to help you. In many cases, you may need glucagon. And I'll talk about that a little later. What's important to remember is always treat with a fast-acting glucose. Do not treat with chocolate. And there's a very good reason for that. Chocolate has a lot of fat in it, and when you treat the low with chocolate, the body takes longer to break down the chocolate and because of the fat in the chocolate. So in the meantime, your blood sugars are going lower. So you should always treat with a fast-acting carbohydrate. The CDA recommends using the rule of 15. So when you have mild to moderate hypoglycemia, you can treat by taking 50 grams of carbohydrate in the form of glucose or sucrose tablets. Why? Because they're very fast-acting, they're very simple sugar, the body can absorb it very quickly. You take 15 grams of carb you wait 15 minutes, and you retest your blood sugar. If your blood sugar is still less than 4, you retreat with another 15 grams of carbohydrate, and then eat a usual snack or meal that's due at the time, or a snack that contains 15 grams of carbohydrate and protein. So the rule of 15, the 15 gram is important because one of the things that happens if you've had a low, there's this need to want to eat everything in sight. And the problem with that is that you have this high blood sugar after you've had the low. So these are examples of 15 grams of simple carbohydrate, your glucose tablets, and the one that I know that's in Ontario and maybe in other provinces as well is the Dex-4. So they say Dex-4 because 4 dextrose tablets will give you 16 grams of carbohydrate, because each Dex tablet has 4 grams of simple carbohydrate. You can do 15 mils or 3 teaspoons or 3 packets of sugar dissolved in about 15 mils of water and drink that. Or you can have 3/4 cup of juice or regular soft drink. And, you know, they also make those, they used to make the chubby cans, the small soft drink cans, and that was about 20 grams of carbs. So that's good if you like soft drink. Or you can have juice such as apple juice. 6 lifesavers. Each lifesaver has about 2.5 grams of carbohydrate. What's important to remember when you take lifesavers is that you need to put all 6 in your mouth. You need to chew them and swallow them. And the strawberry and the fruit-flavored ones are better. You can also treat a low with 1 tablespoon of honey. Remember, though, you cannot give honey to a child under 1 year of age because of the fear of botulism. So how do you treat a severe low? Because we were talking about mild and moderate. Now we're talking about a severe low in a conscious person. So someone who can speak to you. Well, you'll treat it with an oral of fast sugar, simple carbohydrate, which 20 grams to relieve the symptoms. Retest in 15 minutes, and you want to make sure that the blood glucose is greater than 4. If it's less than 4, you treat again with 15 grams of carbohydrate, and then eat the usual snack or meal due at that time, or have a snack that's 15 grams of carbohydrate plus a protein. What about someone that is unconscious, that's not responding to you? One of the things to keep in mind is that if you know you are at risk of severe hypoglycemia, is to discuss the glucagon kit with your healthcare provider. You do need a prescription for this, so you have to get a prescription from your physician or your nurse practitioner. When unconscious and glucagon is given, do not leave the person alone. This is very important because vomiting can occur. Turn the person on their side, and as soon as that person becomes alert, give them 20 grams of rapid-acting carbohydrates such as juice, followed by a protein and carbohydrate snack. And this is very, very important because when you give glucagon, what it does is it stimulates the liver to release glucose into the bloodstream. So as soon as that person becomes alert, you want to make absolutely sure that you get some juice and some protein and carbohydrate, get them to eat that. Also good to remember is that glucagon comes in as you can see in the picture, there's a syringe and there's the solution, there's a vial with some powder in it. You can only mix the glucagon right before you give it and make sure that it is clear, you can see through it. Once everything is back to normal, troubleshoot and find out what caused the low so that you can prevent it from reoccurring. So what are the concerns about having the low? I'm sure you go to your doctor or you go to your diabetes educator and they will ask you, how many lows have you had in the past month or in the past 2 weeks or week? Well, there is a very valid concern, which is hypoglycemia unawareness. And what this is that if you have repeated lows, the body loses those early warning signs. And this can be problematic because you are at greater risk for injury, especially when you're working with heavy equipment or machinery, and you have increased risk when driving, as well as having repeated severe hypoglycemia or lows. If you have a history of long-standing type 1 diabetes, the risk for lows and hypoglycemia unawareness may increase. And it's the same for type 2 diabetes. When you're treated with insulin and have other medical conditions, the risk for lows and hypoglycemia unawareness may increase. Now, this is something I think that everyone that takes insulin or diabetes medication that helps their body to make more insulin needs to be aware of. The hypoglycemia and driving, and this can also be found on the CDA, on the Canadian Diabetes Association website. A safe blood glucose before driving should be greater than or equal to 5. So it says don't drive if you are less than 5. So if your blood glucose is less than 5 prior to driving, take 15 grams of carbohydrate and recheck in 15 minutes. If your blood glucose was less than 4 millimole, wait at least 45 minutes after the blood glucose has reached 5. Only then is it safe to drive. They have done some studies which showed actually that although physically you feel capable of driving, that what happens is when you've had a low, you need that 45 minutes because your reaction time to an incident will be slower. And they've actually shown this. This is why, although you feel good, you still need to wait that 45 minutes. When you are driving for long distance, you should check your blood sugar at least every 4 hours. So take action every day to prevent lows. Test your blood glucose regularly. Always carry a meter and fast-acting glucose with you. And sometimes, you may forget your meter. If you feel a low, what's more important is treating it immediately. Even if you don't have a meter but you feel shaky and you feel sweaty, if you take 15 grams of carbohydrate, of those little tablets or whatever you want to carry for when you have a low, if it goes away after you've had the 15 grams of carb, then you'll know, okay, that's fine, I must have been low. Wear a Medic Alert bracelet. And I know a lot of people don't like telling coworkers or telling friends that they have diabetes, but sometimes this can really help when you're having a low because they can provide you with some support and help you. When drinking alcohol, I cannot stress this enough. Always make sure that you test your blood sugar, especially before going to bed, and eat while you're drinking. Very important. Don't go to bed with a low blood glucose. As I mentioned earlier, the body is so busy processing the alcohol that it may not always put glucose into your system to bring your blood sugar up should you have a low. Strenuous and prolonged exercise may also, you may also have a low that continues you may have a low up to about 24 hours after the exercise. So what's very important is to test before, test during, and test after to make absolutely sure. And also, if you're going to be doing this exercise again, you may have a better idea of, when you will have a low. Testing at 3 a.m. to make absolutely sure you are not having lows overnight. If you wake up and you feel very tired in the morning, or if you wake up and you felt you had nightmares, it's a good idea to test your blood sugar at 3 a.m. in the morning, just to make absolutely sure that you're not going low at night. So what are some tips with managing diabetes? managing lows, when you have diabetes, record your blood glucose levels to keep track of when you're having a low. Keep a diary of your meals, your activity, and this will help you and your healthcare provider to identify when you are at high risk for having lows. Learn how to adjust your insulin levels when exercising. You know, how long before exercising, what type of exercise you're going to be doing, how long you're going to be doing it. Talk to your healthcare provider. Always try to identify what caused the low so that you can prevent it from happening. There are now much better meters on the market. We have the newer meters. Technology has improved, and there are meters that can keep track of your blood glucose, your food, your activity, and as well as identify patterns in low blood glucose and can tell you, when you look at it. And of course, you can send these to your healthcare provider, so you don't have to see them all the time. You can just send the data to them and then discuss it. So now we have another polling question. Hyperglycemia is 1, when there is more insulin in the blood than glucose, or 2, when there is more glucose in the blood than insulin. Let's see the response. You're absolutely right. When there is more glucose in the blood than insulin, that is when you have hyperglycemia or highs. And usually the blood glucose level is greater than 11 millimole. And you may feel thirsty, you may have blurry vision, you may feel dizzy, weak, want to throw up, you may have abdominal cramps. Other symptoms may include increased urination. And a lot of people think that because they're going to the washroom, that is why they need to drink more, because they are passing so much urine. More frequent infections, when you have cuts and sores that are slow at healing, unexplained weight loss. These are some of the signs of hyperglycemia or highs. So what causes high blood glucose? Well, this can happen when you skip your insulin, or you're not taking enough insulin or diabetes medication, when you have increased food intake, too little or decreased physical activity. For example, you may be working out every evening for a half an hour after work on your way home. However, for the past week, you've been working later at work. You're not able to do the physical activity. Injecting insulin into overused or hardened injection sites. And this is something that is very, very important, because I think sometimes we don't pay attention to that. When you're sitting down, you get used to just raising up your shirt and injecting. So I tell people, whenever you go to give your insulin injection and you find that the needle is not going in, the pen needle is not going in very easily, always suspect that there might be a hardened or overused site. And the danger of this is that the insulin will not be absorbed as it should be, and so you will have high blood sugars. So, very important, overused or hardened injection sites. So if you ever come across that, you find there's some resistance when you're giving your injection, don't give it there, take it out and choose another site. Insulin that is expired or exposed to extreme heat or cold. And this can happen very easily. It can be in winter. You can have you go out for dinner, you have your insulin pen in your bag, and it falls out in the car. And the next day and that night you take your long-acting insulin, and then the next morning you get in the car and you say, oh gosh, I've got my insulin here, and you put it in your bag, and of course it defrosts and it seems okay, it looks okay. However, if it's frozen, it will not work. So, things can happen, so it's good to be aware to make sure that your insulin is not exposed to extreme heat or cold. Stress, very important, also increases blood glucose levels. Illness, injury, and infection, you will see your blood glucose levels go up. certain medications such as steroids. How does illness increase blood sugars? Well, when you're ill or you're stressed, the body produces hormones to help the body fight infection and overcome the stress. These hormones causes the blood glucose levels to increase. So actually, during illness, you need more insulin, and as well as during times of stress, you may need more. What about exercise and highs? Well, when you exercise, the body needs glucose and insulin to provide you energy. When your blood glucose levels are high, there is not enough insulin in the body to change the glucose into energy. So it's suggested that when you have type 1 diabetes, to avoid exercise if blood glucose levels are greater than 14 millimoles and ketones are present. If you have type 2 diabetes, use caution when your blood glucose levels are 17 or greater with negative ketones. When you have type 2 diabetes and your blood sugars are 12 or 13, you can still exercise because you still have some insulin in your body. And sometimes when your blood sugars are 12 and 13 and you have type 2 diabetes, that exercise will actually bring your blood sugars down. It's when the blood sugar goes to 17 and higher that it's not recommended that you exercise. You should talk about exercise adjustments with your healthcare provider, and in the instance when you have type 1 and it's greater than 14 and ketones are present, you need to give yourself insulin and before you can exercise. What do you do when your blood glucose levels are high? One of the most important things is to always take your insulin and diabetes medication. Even when you are sick. A lot of times people think that they're not eating, I'm not eating any food, so why am I taking the insulin? Actually, as I mentioned earlier, it's because of the hormones, you need more insulin rather than less. Drink at least 8 to 10 cups of sugar-free fluids every day. And I want to stress the sugar-free part of it because sometimes when blood sugars are high, people feel thirsty. And when you feel thirsty, this may be a time that you just grab a bottle of juice and drink it because you feel so thirsty. However, make sure that it is sugar-free. And the best thing to do, of course, is to drink water. Test your blood glucose levels every 2 to 4 hours. Call your healthcare provider about medication adjustments. So if you're going to exercise, if you're not sure what to do, talk to your healthcare provider. Ask them what you can do to adjust your insulin. During illness, always make sure that you have sick day management so that you know what to do. If you have type 1 diabetes, test your ketones every 2 to 4 hours if you are feeling unwell. Go to the emergency if you are vomiting or have diarrhea and unable to eat for 12 hours. And if you have ketones greater than 3 millimoles. So what are the concerns about having highs? If high blood glucose levels are not treated and remain consistently high, that is greater than 14 millimoles, it can lead to severe high blood glucose levels. And in type 1, it can progress to diabetic ketoacidosis, or as we normally call it, DKA, which if left untreated, can be life-threatening. So again, speak to your healthcare provider about sick day management. And remember, if you vomit more than 2 to 3 times, you're unable to hold food down and have ketones in your blood or urine, you need to call your healthcare provider. And if your ketones are positive and they are greater between 1.5 and 3, you should go to the nearest emergency. So concerns with type 2 diabetes about having highs. Well, again, High blood glucose levels can progress to hyperglycemic hyperosmolar syndrome or state, which if left untreated can be life-threatening. If you are unable to eat or hold food down and have other medical conditions such as cardiac conditions, you can become dehydrated very quickly. Call your healthcare provider and test your blood glucose levels every 4 hours. If you are older, you may need some medical assistance. So what action can you take? Well, you can test your blood glucose regularly. Talk to your healthcare provider about sick day guidelines so that you know what to do, so that you are prepared. When you are not feeling well or stressed, be aware of your blood glucose if it increases and stays high. Everybody has an odd high blood glucose level once in a while. It's when it's consistently high, when you see it's not coming down. That's when you need to be concerned. Know when it is safe to exercise and know how to adjust. Tell your healthcare provider if you take steroids or if you have to take steroids for another condition. Sometimes people buy hydrocortisone cream over the counter because they have a rash. That is still a steroid, and when you apply it to your skin, it will get absorbed and your blood sugars can go up as well. Wear a medical alert or have some form of medical identification on you at all times. And something I learned recently, that on a lot of cell phones, you can now have an emergency profile which can be preset on some phones. So it will be right on the cell phone. Nobody needs to go or know how to get into your cell phone. It is simply marked emergency profile. And what you can do is you can set up the parameters. So you can state your name, who to contact, that you have type 1 diabetes, what type of insulin you're using. And this is very important information. Should anything happen, people have the necessary information that they can help you right away. So what are some tips with managing highs? Well, always remember with highs, food, questions to ask yourself, is it caused by food? So have you increased your portion sizes? Have you changed your food choices or eating patterns? You know, sometimes people have their big meal in the evening, but they may suddenly decide that they're going to eat their big meal at lunchtime and forget that, you know, the insulin is geared for the larger meal, the meal insulin at supper. And now that they're eating a larger meal at lunch, they may need to have the insulin adjusted. Take the right dose at the right time. Has your insulin spoiled or expired? When you buy your insulin, check to see when does it expire. If necessary, change your insulin, change the cartridge, and see if it makes a difference. Does it feel like your insulin is not working? If that's the case, it can be either expired or you are injecting into hardened, overused areas, which we call lipos or lipohypertrophied sites. It means that it's hardened and the insulin is not being absorbed. It's sitting in a little depot there and it's not helping to bring your blood sugars down. When you see your healthcare provider, ask them to check if you're not certain. Or if you feel you have any lipos and you're not sure, ask them. Activity. Have you decreased or skipped doing some activity? Has that changed? Talk to your healthcare provider and make sure that you know what to do when you increase your activity or change your activity. Monitoring. This is very important too, because have your strips expired? I recently had someone who came into the office and we looked at her monitor, and when she opened, she had test strips that had expired 4 years ago. She had found the strips and, you know, just started using it and clean forgot that she had to check the expiry date. Another thing I think is very important is not to take the test strips out of the container and carry it separately. Because this can happen. People sometimes change their purses, their wallets. They want to use smaller wallets and they take out a few test strips and just throw it in their kit. not a good thing to do because the test strips are light and moisture sensitive, and they're also wick fluid. So if any drop of fluid falls in the container, it will just spoil the strip or could affect it. Has your meter been checked? Have you had it calibrated? So it is recommended that you have a lab meter check done at least once a year for accuracy. And what is done usually on the requisition when the doctor sends you for your lab work, you can ask them to add lab meter requisition so that after the lab technician has taken the blood from your arm, they will then ask you to prick your finger and to test your blood sugar, and they will write this on the requisition, your blood glucose reading as well. So the reading from your meter should be within 15 to 20% within the lab, so it can be higher or lower. So let's say the lab blood glucose is 10. Your meter can read anywhere from 8 to 10, which would be 20% lower, or it can read between 10 to 12, which would be 20% higher, and that would be acceptable. And again, I can't stress this enough. Talk to your healthcare provider about sick day management. So in conclusion, I'd like to summarize and say that when we're talking about hypoglycemia, it's very important to treat the hypoglycemia as quickly as possible. As soon as you feel the symptoms, treat the hypoglycemia. Always carry a fast-acting carbohydrate with you. And the reason is because a low can very, very quickly progress and become more severe. When we talk about high blood glucose levels, again, we want to make sure that you test, that you know sick day guidelines, that you know what to do when your blood sugars increase and when you exercise, that you know how to adjust your insulin. I'd like to thank you for your attention, and if you have any questions, I'd be happy to answer them. Thank you very much, everyone.
Thank you so much, Celia, for developing and delivering a very informative presentation on managing blood glucose levels and really for providing us those great tips. Those are very useful, so we really do appreciate your time today. Just as Celia has mentioned, we will be starting our question period now. So we do have, it looks to be quite a few questions here, so we'll do our best to try and get through as many as we can. And we do apologize if we don't get to your question, but please email us at webinars@diabetes.ca, and we'll be happy to follow up with you. Celia, our first question here is from a participant that has said, I have a 14-year-old daughter whom has had type 1 for 8 years. How does puberty and hormones affect blood glucose levels?
Well, that is a very, very important question because we know that hormones, especially during puberty, what happens is that you will need more insulin because you become a little insulin resistant. There's a lot happening during puberty. There's growth hormones. There's all kinds of hormones, things happening within the body. So definitely during this time, your daughter will need more insulin. And you need to discuss this with your healthcare provider. And this is where testing becomes very important because, you know, as over time you can see that, oh, they need a little more insulin. And this is because of the hormones and insulin resistance. Very good question. Thank you.
Thank you for that response, Celia. Our next participant has asked, I use honey on a cracker for treatment. Is that okay?
Yes, as long as you're older than 1 year of age. Yes, you can have honey on a cracker, you know, because crackers really, when you think of it, is really carbohydrate. So it shouldn't be a problem because the honey is a very, very simple carbohydrate that will be absorbed very quickly by the body. So yes, you can. Make sure that you have a tablespoon, though. So it must be a big cracker.
Great. Thank you so much for that, Celia. Our next participant has said, if you have exercised for a long time to the point that glycogen levels are depleted and you're unable to take glucose, will glucagon work?
We don't really recommend glucagon for that purpose. First of all, I'd like to know how you know you've used all your glycogen stores. We don't really know how much our body and our liver stores the glycogen and it can convert it back into glucose. So it's a matter of when you are exercising for a long time, there's something called X-carbs. You can look it up. Dr. Perkins talks a lot about it, which helps you to give yourself glucose while you are exercising. So hopefully you won't reach the point where you are totally depleted of glucose. Again, I don't think that it's a good idea, because all glucagon does is it stimulates the liver to release glucose. And where does the liver get the glucose from? It's from glycogen that it's changed into glucose. So you have to be very, very careful when you are exercising. Perhaps you want to review with your healthcare provider what you are doing, and perhaps there's another way of doing it so that you don't deplete your stores. With glycogen depletion as well, when you're exercising for long periods, that's also a lot of times where you have a lot of delayed lows, and you'll have lows later. But I do not think you should use glucagon. You can talk to your physician, to your endocrinologist about it, but I don't think that's the purpose of glucagon, because even when it does release glucose, it's not a large amount, and it's a very short period, and the purpose is to have someone just get enough so the liver can release just enough so that the person is alert and can swallow and eat something. I hope that answered your question. Thank you.
Thank you so much very much for that detailed response, Celia. Our next participant has asked, to your knowledge, do truck drivers living with type 2 diabetes require to test blood glucose levels more often than every 4 hours?
You are absolutely right. There are special instructions for commercial driving. So when you are a truck driver and you're driving long distances, it is recommended that you test more often. And always remember to keep to have a meter that has a memory so that you know that you are not going low. I would suggest that you go to the Canadian Diabetes Association website and look at the commercial driving, and you're absolutely right. You should be testing more than every 4 hours. You should be testing 2 to 4 hours.
Great. Thank you so much for that, Celia. Thanks for that. Our next participant has asked, why is it not recommended to exercise with blood glucose levels of 17 millimoles per liter or higher? Could it be harmful to the individual?
So when I made that reference, I was referring more to people with type 2 diabetes. So I want to make that very clear. With type 1 diabetes, it's actually when your blood sugar is greater than 14. With type 2 diabetes, it means when your blood sugar is 17, the higher the blood sugar, the less, it means the less insulin you have in your body. So when your blood sugar is very high and you don't have a lot of insulin, what that means is, because if you have type 2 diabetes, remember you have a little bit of insulin. Your body is still making a little bit of insulin. When your blood sugar is that high and you exercise, and you don't have enough insulin, your blood sugars are only going to go higher because your body doesn't have enough insulin, but there's still enough insulin so that it doesn't start breaking down the fat for fuel. But it's not recommended when you're higher than that because, as I said, your blood sugars are simply going to go higher. You should treat it first and then you can exercise. I hope that made sense to you.
Thank you, Celia. Our next participant has asked, and this is a question that's come up a couple times this evening, is what are ketones and how does one test ketones at home?
So that's a very good question. Ketones, so normally when you have, let me start out by saying when you have type 1 diabetes, it's regarded as an autoimmune disease where your body has destroyed all your insulin-producing cells. Now, we know that we use glucose for energy. However, when you don't have insulin in your blood, when you don't have insulin in your body, the body cannot use glucose for energy. And what happens is when you have type 1 diabetes, the body starts breaking down fat for energy because it can't use the glucose because you have no insulin. So it starts breaking down fat. And when it breaks down fat, the byproduct of this is ketone bodies. And the danger, ketone bodies, when it gets into the bloodstream, it causes an upset in the chemicals in your blood. And what happens is you can become very, very, very sick. So ketones is something that mostly was type 1 diabetes. It very rarely happens in type 2 diabetes. It can happen when you have type 2 diabetes for a very, very long time and you are very, very sick. But the ketones come about because of the body not having enough insulin, and so it starts breaking down fat to give it energy to do what it needs to do. And that is called ketone bodies. And as I mentioned again, it's mostly in type 1 diabetes that you have, that you need to be concerned about, because that is what happens and causes DKA. Diabetic ketoacidosis is the release of the ketone bodies into the bloodstream. And it upsets the electrolytes, what we call electrolytes that's in your blood, and this can make you very, very sick.
Thank you so much for that response, Celia. Unfortunately, folks, we're just coming down towards the end of the hour here. So for the questions that we didn't get to, please email us at webinars@diabetes.ca. But with that, I'd like to ask our last question, which has come up a couple times today. One of our participants has asked, with type 2 diabetes, I'm finding sometimes that I have higher numbers in the morning before breakfast. What causes that?
And that's a very good question, and it usually, a lot of times, it's really upsetting to people because they go to bed with a blood sugar of 7, and they find they may wake up with a blood sugar of 10. So this is called the dawn effect. And what happens in the early hours of the morning between 4 and 6, what the body does is it releases what we call counter-regulatory hormones. And one of these hormones is glucagon, which of course stimulates the liver to release glucose in the blood. And the problem is it takes the blood sugars and it makes your blood sugars go higher. So when you're taking insulin, you can talk to your healthcare provider and see if you can adjust your insulin at bedtime. It's always good, though, to make sure that you test your blood sugars at 3, but that is called the dawn phenomena. And it's caused by the release of counter-regulatory hormones into the bloodstream in the early hours of the morning between 4 and 6. And the reason we have these hormones, it's like the body's telling you, here are your hormones to get you going in the morning, to get you up, to give you energy. So that's why they put some glucose into your system. And if you don't have diabetes, normally your pancreas just makes more insulin and the blood sugars will be normal. But when you do have diabetes, then unfortunately the blood sugars go up in the morning. Hope that answered your question. Thank you.
Thank you so much for that, Celia. And folks, that does conclude our webinar for today. Thank you very much for your participation. We would like to once again thank our sponsors, Canola Eat Well and LifeScan One Touch, for supporting our webinars today. They've actually provided us with some great resources, which is located in the resource section there at the bottom of the webinar there. So please download those resources and use those resources for your knowledge. I'd sincerely like to thank Celia Celia for speaking on behalf of the Canadian Diabetes Association. Once again, Celia, it's been a really great learning experience. I do want to remind everyone that our webinars will be made available online to everyone in the coming weeks. We have a couple more webinars coming up to end us off before the end of the year. So next week we'll be having a webinar on diabetes myths. Thereafter we'll be discussing diabetes and stress. And then into December we'll also be talking about some holiday survival tips to stay on track with diabetes. And we'll end off the year discussing the glycemic index. So we do hope that you will register for those, and we hope to see you for those in the near future. And for those of you that are in Ontario, we are hosting 2 more free CDA Expos. So we have one coming up this Sunday, November the 20th in Kitchener, as well as the following weekend on Saturday, November the 26th. That's the South Asian Expo in Brampton. So we do hope to see you all come out. If you'd like some more information on our expos, you can visit our website at diabetes.ca/expo. And for those of you who some of you may know or may not know, November is Diabetes Awareness Month. So to all of your networks, we encourage everyone to take the tests and know their risk for diabetes. So some of you may know that 1 in 3 Canadians already has diabetes or prediabetes. So it's important that we share this test with all of our networks, and we get everyone to take the test and know their risk for diabetes. Okay, so visit the website there and spread the word on that as well. For those of you who need any other information or for looking for more support and resources, please do not hesitate to call us at 1-800-BANTING. So that number is 1-800-226-8464. We sincerely thank you for joining today. We hope you've enjoyed learning with the CDA, and we look forward to your participation in the future.